All right, don't worry, you'll be fine. Whatever your case is, you'll be fine. Right. So let's begin. Let's begin to talk about the signs of preterm labor and what to do. Right. The signs of preterm labor and what to do. And what to do. Basically, we're going to be looking at, we're going to help you understand the early warning signs that should never be ignored. Early warning signs that should never be ignored. And why is it that this topic is so important? But before we begin, please, if you are listening to me, I want you to type in the comment section. Just type ready. I want to be sure how many of us here are ready for this information. How many of us here are ready for this information tonight? Oh boy. Oh boy. I'm so glad that people are learning all around the world. All right. So why is this so important? Why is this so important? Listen, preterm labor is one of the most misunderstood and frightening experience in pregnancy, unfortunately. It's so misunderstood. And like I always say, of course, if there is ignorance in a thing, fear it arouses fear because people are always afraid of what they don't know. Right? So, many women will say things like, I thought it was just gas, right? Some others will say, I thought it was normal pregnancy pain. Some others will say, I didn't want to overreact when I was feeling that thing. These are the kind of things you hear. But the truth is this: preterm labor is one of the leading causes of newborn illnesses and deaths worldwide. Like, when I talk like this, my mind is just flooded with the many cases I've seen over the years. And sometimes, anyway, that's why I'm here, because I'm sure if people are knowledgeable, most of those things will not happen, right? But it's interesting to know that it's one of the leading causes of newborn illnesses and even newborn deaths worldwide, right? Just hold on with your question. Just engage. Hold on with your questions. We'll give you more than enough time to ask questions. Is that okay? Onyi Damola, I see you. And it's also important to know that when you take early actions, you are more likely to save lives. How did they say? Early diagnosis save lives, right? And that's why it's important you know what to do, because you need to understand the signs. Understand the signs. And also understand that the signs does not create fear. If you know what the signs are, you should not be afraid. It creates power and preparedness. You say, oh, I've heard this before. This is the way I'm feeling it. Now I'm prepared. I know the actions to take. And before long, both you and your baby is all right, and we're all happy. Is that okay? So, straight to the gist. What is preterm labor? What is preterm labor? If you are just joining, you're welcome. Make sure you're tapping on your screen. And if you've not followed me, follow me now. Right? What is preterm labor? Preterm labor is it's when the body starts the process of childbirth before 37 weeks of pregnancy. Let me let it soak. Preterm labor is when the body starts the process of childbirth before 37 weeks of pregnancy. Is that clear? Is that clear? I'm sure I still have people in the house listening to me. Right? And this includes the regular contraction. For those of you that were here 2 days ago, right? we discussed, even yesterday, I think, we discussed about um, Braxton Hicks. That was yesterday. Braxton Hicks contraction versus labor contraction. So you already have a clear understanding of what I'm talking about, right? So this preterm labor will include regular contractions. It includes cervical shortening or opening, right? It includes pressure or pain that is signaling early delivery. Excuse me. Yeah. Braxton Hicks, Christy label Hicks, Hicks, right? Hicks. So, like I was saying, so this preterm labor includes regular contractions, cervical opening or even shortening, pressure or pain that signals early delivery. Is that okay? Is that okay? A baby, a baby that is born too early may struggle with breathing, will struggle with feeding, will struggle with temperature control, will struggle with infection, even long-term developmental issues. Now, if you were here, we're talking about second trimester. You remember how we said that most of the things that the baby does after delivery, it were all rehearsed, right? So just imagine they brought you to perform on the main stage in the main event while you were still rehearsing. You've not gotten a hold of your lines. You've not gotten a hold of your moves. You were still rehearsing, and bam, the show has started. What is the most likely thing that will happen? You're going to flop. Why? Because you have not rehearsed enough. So the same thing happens. A baby that is born too early will struggle with breathing, will struggle with feeding, will struggle with temperature control. Yeah. Of course, infection, because they don't have enough immune system to fight the kind of infection that is in the air, right? And there will definitely, or maybe, there will be some long-term developmental issues. But the good news to all this is that many of these cases can be slowed down. You can either just slow it down, you can stop it, or even manage it if you catch them early. Anyway, that's why we are here discussing it tonight, right? So when is preterm labor most common? Good evening. If you are just joining, I see you. When is preterm labor most common? If you are still here, just type on the comment section. I want to see you. I want to see your interaction. Type in the comment section, I hear you. Let me be sure you are still there, right? If you're still here, type in the comment section, I hear you. Joyce, I see you. Right. All right. So when is, oh, Lady G is here. I see you. When is, Elena, I see you. When is preterm labor most common? You see, preterm labor can happen at any time, right? It can happen at any time. But it is more common between 28 weeks of pregnancy to 34 weeks of pregnancy. Where is that, my friend that is listening from the clinic? Are you understand? Please talk to me if you are still here. I'm sure they are already attending to you. But if you are still here, talk to me that I hear you. I want to be sure you are here. Don't worry, you'll be fine. All right, you're here. Good, 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 good. You're here. Right? So, preterm labor is more common between 28 weeks of pregnancy to 34 weeks of pregnancy. In these are the categories of individuals is also common with in women with previous preterm birth. So if you've had preterm before, you are at risk of having preterm again. Is that okay? That's the first one. Those with multiple pregnancies, whether it's twins, triplets, and so on and so forth. Right? So those of you that are always saying, "Oh, God bless me with twins." Also, as you are praying for the twins, also pray that you carry them onto maturity because it's not enough. It's not enough to carry twins. Do you have what it takes to carry it through? Right? So the first category of people who have had preterm labor before are at risk of having preterm labor again. Multiple pregnancies, twins, triplets, are in that category. Those with uterine or cervical issues, right? Women with infections. Let me pluralize it. Infections. And those with high stress. High stress. Good evening if you're just joining. High stress or those involved with heavy physical activity. Right? So these are the category of women that are more prone to preterm labor. Is that okay? If that is okay, just type okay. Let me be sure I'm still talking to you. Just type okay. I need your engagement. Gina, I see you. You're welcome. If that is okay. Type okay. Then we'll go to the next thing. The next thing is the early warning signs of preterm labor. Let the thing not go and catch you at home unprepared, right? Let it not catch you unprepared. I don't know what you're asking now, Purity. But you ask your questions when we're ready for you. Is that okay? So, early signs of preterm labor. What are the early signs? I don't want you to be caught unprepared. Yeah? Let me see this. Okay. Okay. I'm actually looking at the background. Yeah. So just to give an idea, the size of the baby as at the time is coming prematurely. Okay. So early warning signs of preterm labor. Yeah. You better be careful what you wish for. If you are just joining, please make sure you are following me. Tap on your screen, share the live, right? And if you have not dropped a heart me, what are you waiting for? Right? Are you waiting until you get preterm labor before you remember to drop a heart? My people here will do like this. Not my portion, right? Not my portion. It's not your portion. No preterm labor for anybody, provided you listen to what we tell you. Is that okay? So let's look at the early warning signs. Early warning signs of preterm labor. And are these is the most important part of the gist. If you missed everything I've said before, don't miss this one. Early warning signs of preterm labor. Number one, I like itemizing very important aspect of my gist so that you don't forget it. Number one. Somebody help me say number one. Somebody help me say number one. Early warning signs of preterm labor. Number one. Oh boy. Number one is regular contractions. Listen, regular contractions before 37 weeks. Regular contractions before 37 weeks. If you are just joining today, you may not catch. If you were here yesterday, you already understand what we mean by regular contractions when we're talking about labor and Braxton Hicks contractions, right? So when you have regular contractions before 37 weeks, these contractions are not random tightenings. They're not random tightenings, right? They are they come every 10 minutes or less than every 10 minutes regularly, and they become more frequent as the time progresses and get stronger. They do not go away even when you rest or hydrate. Remember, in Braxton Hicks contraction, when you hydrate, it can go away. When you rest, it can go away, right? When you even change position, it can go away. But with this preterm labor, it does not go away. You rest, it doesn't go away. You hydrate, it doesn't go away. You even change position, it still doesn't go away. You feel the rhythmic and continuous contraction. Yeah? That would need attention. So you want to quickly go and see your doctor. So that is number one. Number two, persistent lower back pain. Persistent lower back pain. I'm trying to be slow because it's a very important discussion tonight, so that everybody can be on the same page. Persistent lower back pain. This pain feels dull or aching. Lower back, for those of us, if men are here and you've been very supportive when your wife was pregnant, one of the places they will ask you to rub is the lower back, right? That is that is our ministry. Our primary assignment is to rub lower back when the problem starts, right? Right. So anyway, persistent lower back pain. You're right. You feel that dull or aching pain at the lower back. It radiates to the lower abdomen, even or to the thighs. Right? Right? And this pain does not improve even when you rest. Right? Does not improve when you rest. Even when you rest. And many women mistake this back pain for back strain, unfortunately. Right? But it's a warning sign. It's a warning sign. That is number two. Let's go to number three. Number three is pelvic pressure or heaviness. pelvic pressure or heaviness. Is a feeling of the baby pushing down, right? The feeling like the baby is pushing down. Something you're feeling like something is about to fall out, right? And that pressure will increase. You have that increased pressure around the vagina or the rectum. Yeah. And this often means the cervix is changing when you start feeling all that. That is warning sign number 3. If you don't catch these points, that's what's happening to you. Oh my God. I hope you're in the clinic now. I hope you've gone to see your doctor now. If you are still at home, you want to prepare your things, go to see your doctor. Unless your doctor asks you to go back, please, you should be in the clinic right now. Right? Please, don't stay at home. Don't let this thing catch you by surprise. You can actually mitigate it. So please take the right actions. That's why we're teaching you. Right? All right. So that is number 3. Where was I? Now, number 4. Oh, you lost the baby. Oh boy. That's sad. Sorry about that. Don't worry. Another one will come and it will stay this time. Is that okay? At least knowledge has come now. Is that okay? You'll be fine. Oh boy. I hate bad news. I hate bad news. Anyway, number 4. User without a picture, without a name. I can see you are typing questions. Can you just exercise patience? When it's time, you send a request and we'll answer your question. Is that okay? Right. And I'm sure you're not even following me yet. So you want to follow me now. All right. The number 4th warning sign is changes. Changes in vaginal discharge. Changes in vaginal discharge. So you want to watch out for the increased amount of vaginal discharge. You want to watch out for watery discharge, which is possibly leaking of fluid. Right? You got to be smart. That's why knowledge is important. So these are the things you're going to watch out for. Increase in the amount of vaginal discharge, watery discharge, more likely is leaking of fluid. You want to watch out for mucus-like discharge, right? Or pink discharge or blood-tinged discharge, right? This can be sign of cervical opening. This can be sign of cervical opening and or rupture of membrane. Right? Oh boy. Am I still here? I hope the network is still fine. If you are still here, say I'm here. Let me be sure. I'm still talking to my people. Please let's hit 50k likes. Thank you guys. Thank you very much. All right. Are we learning something tonight? If after all the information we gave this year, you did not learn anyone from inside, you cannot blame God for not blessing you in 2025. Because there's so much information we've shared that you may never get anywhere else. Right? So, that is number 4, warning sign. Number 5, Thank you for the follow. Number five is actually the regular and easy to detect, which is the abdominal cramps, right? All right, don't worry, the baby will come, right? Abdominal cramps, like period pain. You're already pregnant and you're having that kind of abdominal cramp, that kind of crampy pain that comes and goes. Yeah, it feels like menstrual cramps and it's not relieving you even with rest. That is a warning sign that you are you are about to have this preterm labor or even having preterm labor. Unfortunately, this is always often overlooked, but it's very important. It's very important. So don't just sit down at home. Don't just sit down at home. It's a warning sign, and you want to see your doctor ASAP, right? The number 16 in the warning sign. I will stop there because I'm becoming tired. Yeah, right. The 16 is um gut symptoms. What I call gut symptoms. You don't feel normal, right? Some women will experience diarrhea, nausea, even intestinal pressure, right? And this can be the body preparing for early labor, right? So when you look at all the six warning signs I've given you, one or a combination of all can be your case. Is that okay? I said you wait for question and answer segment. Eh? Why una blood to the rush? Una blood to the rush. All right. All right. But let's tap on our screen, share the live. If you are just joining, make sure you are following me, right? Follow me. And if you've not dropped a heart to me, why are you like this? Why are you like this? All right. All right. Let's compare. Let's compare preterm labor, what preterm labor feels like, right? And what normal discomfort in pregnancy would be like, would feel like. Is that okay? Let's let's make that comparison. Normal pregnancy discomfort versus preterm labor. You see, okay, I did not advise people today. Every time I always advise people, if you're on my live stream, make sure you have a pen, a paper. More likely, you will hear something you've never heard before, or even increase the knowledge of that which you have heard before. So please, if you are not writing, I feel sorry. I don't know how else to help because we may not come back to this information anytime soon. Hi, Olaide. I'm fine. Thank you. Good to see you. You're welcome. So I said, let us compare normal pregnancy discomfort versus preterm labor, right? What do you feel in normal pregnancy discomfort? Say this, I'm pregnant and this pregnancy is causing me discomfort, which is different from preterm labor warning signs I just gave you. Yeah. In normal pregnancy discomfort, one of the things that is very common is random aches. Random aches. You feel pain here, you feel pain there, now and then, not regular. It's just you know, it's just a discomfort that is common with pregnancy. But in preterm labor, the pain is rhythmic. It comes in rhythm. How does it come? Lower back, it radiates to the lower abdomen. In that sequence, tightens and release in good intervals and successions. So it's a rhythmic kind of pain. Normal pregnancy discomfort you have uh, when you have those kind of aches that is random. When you rest, it goes away. Just like we talked about Braxton Hicks yesterday, right? But in preterm labor, that pain persists. Even if when you rest, the pain will persist. In normal discomfort you have, it's usually occasional. It's not something that is always there. It's occasional. Whereas in preterm labor, this pain is frequent. Frequent pain in the manner of described, and it also intensifies. It intensifies, right? Whereas the normal discomfort you feel is just mild. Is that okay? Um, in discomfort that is normal with pregnancy, no discharge, but in preterm uh, labor, you see discharge and changes in discharge. Is that okay? So everything I've taught you, everything that you already know it, trust the pattern, and see your doctor as soon as you are not sure of what's going on with you. Make sure you see your doctor. Call your doctor on phone. Call the ambulance. Go there. It's better. Remember what we said yesterday. It is better to have a false alarm than to arrive in the clinic late. If you did not hear anything today, hear this one. It is better to have a false alarm in your pregnancy than to arrive the clinic late. This year, my prayer is every pregnant person that I know will not lose their pregnancy. That's my prayer in 2026. And the answer to that is amen. Those who are pregnant will carry their pregnancy to term, and they will not make mistakes that will cost them their baby. I've seen too many loss, and I don't want that to continue. This 2026 will be better. Don't worry. Any complaint of the past, let it pass. But 2026 will be better. That is why these are the things you must do when you notice these warning signs. If you notice these signs that I mentioned, the things you want to do are: step one, stop whatever you are doing. Stop in your tracks, whatever you are doing. Lie down on your left side. Step two, hydrate. Of course, those of you that were here yesterday, you already know why. Hydrate. Right? Step three, time the symptoms. In other words, count how often the contractions come per hour. Right? Count it. Then, while you are doing what you need to do, call the ambulance, call your health provider, call your doctor, or have your partner take you to the clinic. Be smart. You don't want loss in 2026. You've got to be smart. Right? So go to the clinic. If the symptoms continues after 1 hour, because you've taken your time to observe, this thing just started, this is the way I feel, and you're counting contractions. So if the symptoms comes after 1 hour, or rather continues after 1 hour, go and see your healthcare provider. If you are less than 37 weeks, remember, preterm labor anyway is labor that occurs before 37 weeks. So if you are less than 37 weeks, you should not be wasting time. And if for any reason you even feel unsure or scared about anything, go and see your health provider. Remember, it's better to have a false alarm than to arrive the clinic late. That singular phrase, is it phrase or clause now? English people, Mona leave me away. That singular statement will save your life and your baby's life. Right? So go to the hospital. Do not wait. Do not wait for me to come on live stream so that you ask me. Don't ask me. Go straight to the hospital. Go straight to the hospital. And your doctor knows what to do from there. And you will be fine. Right? Okay. So if you are still here, please type in the comment section. Talk to me. Talk to me in the comment section. Say I'm here. Just type I'm here so that I'll know that I still have people alive and ready. Right? Talk to me. Oh boy. All right, it's good. I'm happy that we are ending the year with so much information that is very beneficial to almost everybody. But don't forget tomorrow. Tomorrow's discussion. Oh boy. All men that you know, invite them for tomorrow discussion. 7 p.m. Nigerian time. We're going to be discussing what Christy Lieber called narcology. Is actually we're discussing recovery time in intercourse, right? Why some people do 20 rounds, some others do 10, some others do 5, some can barely do half round and they're almost passing out, right? So tomorrow's discussion strictly for men. Women, you can come and learn, because anything that happens to John Thomas happens to you, right? So you want to join. So you want to be around tomorrow. 7 p.m. Nigerian time, we'll begin the new year with recovery time, right? So that's discussion tomorrow. All right, just to reiterate, who is at higher risk of preterm labor? We talked about it before, but I know some people are just coming. So you may be at higher risk of preterm labor if you've had preterm labor before, right? Who is asking this question? You are just coming. That's why you're asking this question. Come on, man. So if you've had preterm labor before, you are at higher risk. If you carry twins or more than twin, some people can carry triplet, quadruplet, sextuplet, and so on. So you're also at higher risk of preterm labor. If you have short cervix, right? If you smoke or use substances, you are at higher risk. Of course, I've talked about the effect of smoke on pregnancy. So if you don't worry, make sure you join the next season if you've missed that one. The next season, you're gonna learn. It's gonna be explosive next year. Next season should start somewhere end of January. You're gonna learn a lot, right? What is local medicine? Can somebody use a Oraimo code for this person for me? Eh? Who is this person? Oh, who asked that question? Halimzi. You asked that question, then bride me with 2 roses. Eh? Halimzi, why are you like this? Eh? Where are you from? Oh boy. Don't worry, we'll answer your question when it's time for question and answer. Is that okay? There is answer for everybody, don't worry. All right. So I said, if you've had preterm labor before, you are at higher risk of preterm labor. If you carry twins or more than twins, you are at risk of preterm labor. If you have short cervix, if you smoke or use substances, if you have untreated infections, why you say go dey carry infection like this? Eh? Untreated infections, right? If you're under severe stress, we live in a day and time where women too want to hustle. You see them with long tummy, hustling. Oh boy. So you don't want to put yourself under severe stress, even physical stress, right? And there are people with abnormal uterus. They too they have high risk of they have high risk of preterm labor. But remember that preterm labor can happen even without the risk. It can happen. In such cases, we call it idiosyncrasy. We don't know why that happens, but it does happen, right? But remember, if it does happen, it's not a time to now start blaming village people, uh, wicked people, fall and die and stuff. That's not the time, because a lot of people feel guilty at such times, right? So please, preterm labor is not your fault. Don't blame yourself. Don't start arrogating things that does not mean anything, right? It's not your fault. The things we've said that could cause it can be stress, even fear, even you fear can even cause you emotional stress, right? So just be careful. Just be careful. And sometimes we don't even know why that happens, because the body can act on its own accord, right? May God bless you also with partners that are very supportive, like we talked about the day before yesterday, so that the partner should be able to take care of you when the symptoms become serious. They are there to support, manage, right? They help you to stay calm and give you all the emotional and physical support that you require to carry through. Very important, right? So before we begin answering questions, send your request, start sending your request. But before we begin answering questions, preterm labor cannot always be prevented, right? But the risk of preterm labor can be reduced, right? So you can please go for your regular antenatal care. That is one of the ways to reduce your risk, because they surely be checking you out every time. Infections, when they are treated early, you reduce the risk of preterm labor. You avoid smoking, alcohol, and use of substances. And I don't know why you want to do that. Don't do drugs when you are pregnant. Leave alcohol alone. Leave smoking alone, right? Stay hydrated. Manage your stress. Manage your stress. And follow medical advice. When you do all these things I just mentioned, your case will definitely not end in tears, right? It will not end in tears.